So the doctor thinks I've got ulcerative colitis.
What is that? It sounds quite bad.
It's a condition that affects the lining in the large intestine. Hello? No, it's okay. I'm going to the hospital tomorrow to see someone. The doctor said I've got ulcers along the lining of the large intestine. He thinks that's why I felt so bloated and why I've had all that pain and cramps. And he also thinks that's why I might have had trouble going to the toilet. Like needing it a lot and then having diarrhea and bleeding when I go. I'll hopefully find out more tomorrow. So, what's new with you?
Hey, you alright? How was the endoscopy? I'll grab your bag. Did they find out if you've got that ulcer thingy?
Ulcerative colitis, yeah. They did all the tests.
What kind of tests?
I had a blood test and they had to take a sample of my stool as well.
Really? So why did you do the endoscopy?
I wanted to see how serious it was.
So then, what's the cure?
There isn't one. The doctor said I'll have it for the rest of my life. Don't look so worried. They say it's something that will come and go. Like when everything's okay, remission they call it. I feel normal and I can pretty much eat and do what I want. It's just when I'm having a flare-up that I've got to be more careful. And I might feel a bit uncomfortable.
Do they know what caused it then?
That's the thing, no one really knows. It's not infectious, so I've not caught it from anyone. And it's not caused by stress either, it's probably been passed to me through my genes. But they can't be sure.
Do you remember I was telling you about my cousin who'd gone through some similar problems? Well, he was diagnosed a couple of years ago. I don't know if it was exactly the same thing as what you've got, but it might just be worth talking to somebody that's gone through something similar.
Yeah, that'd be great.
Yeah. Do you grab a coffee then?
Yeah.
Yeah, let's go.
For most patients with ulcerative colitis, they have to take regular anti-inflammatory medication specifically for the bowel wall. The most common drug is a drug called nazalazine. They reduce any inflammation there is in the bowel, and the idea is to bring the inflammation under control and help keep you in what we call remission and keep you well and keep you better.
Well, I need to have an operation.
You'll only need an operation in the most severe cases. They say the lifetime risk of requiring operation with ulcerative colitis is about 25%, but as I say, it's only in very rare situations, and it's when all other medication fails to bring the condition under control.
No, it's fine. Like you see, no one really knows what causes Crohn's disease. There's lots of similarities to colitis, but there are some other side effects too.
Like what?
Well, with Crohn's disease, the inflammation can be located anywhere in the digestive tract. So it's not just my large intestine that can be affected, but any part of my digestive system between my mouth and my bum. Some Crohn's patients also suffer strictures, which can make swallowing difficult, or tears in the lining of the anus, called fissures, or even fistulas, which is when a small channel develops at the end of the bowel. But don't worry, most UC patients don't suffer with these symptoms.
What treatment are you on?
I take aminosalicylates, which is probably what you take too. And then, other things can be prescribed, like steroids or, other sorts of medication, like immunomodulators.
Have you had to change your diet?
No, not really. My condition's similar to yours in that respect. I know what sort of foods are going to cause me to have a flare-up, and I'll avoid those. I can mostly eat what I want. Well, not everything if I want to look good too. So, when was you diagnosed?
My mum is driving me mad.
Why? What's she doing?
Nagging me about taking my medication all the time. I feel like a little kid again. It's not as if I'm not going to take it and risk having a flare-up.
It says here, fish oils can help with UC as they reduce inflammation.
She's off on one again.
Did you hear me, Jane?
Yes, Mum. I already know all this. Pro and prebiotics like asparagus, onion and garlic help as well.
Hey, love, I'm just trying to help. It's just good to know so I can help you with your medication and diet. I don't want you to fight this alone.
I know, Mum. It's great that you're helping.
How are you feeling?
I feel great. I found loads of tips that'll help me manage my UC, so I can get back to feeling like normal again.
Oh, now, I was thinking of buying your dad a birthday present.